My name is Jason O'Grady. I'm a third-year family medicine resident, and had the privilege of going to Togo, West Africa, with the Mayo International Health Program. Included a lot of seeing patients in the hospital, a lot of emergency C-sections, surgeries, and then of course doing clinic work when we weren't rushing over to the hospital to admit patients. There were people that walked from neighboring countries to come to this hospital and to get care. One of the most exciting things for me was every Thursday I was able to go out to a mobile medical clinic, and I was the only physician. We took a couple of nurses with us, took supplies of pharmacy, basic medical supplies, and we drove basically an hour to 3 hours out of the hospital area into local villages and provided care for those patients all day long. Which was fantastic. One of the things that I tried to impress on my Togo nurses that were there is the importance of speed when we're having a young child that comes in with, let's say, malaria that's already in respiratory distress. Over the course of the month, I was able to help them understand that the sooner that we're able to get blood for this infant, for example, the sooner that we'll be able to provide life-saving care. It was rewarding to be there to be able to provide care for people that otherwise either would have died or would have had life-changing illnesses that would not have been treated. And so that was personally gratifying, but it was also rewarding for me to be able to partner with the local nurses and the local PAs to kind of help them and provide some relief for them. And that provides us a lot of on-the-job training and also getting in to see a lot of the tropical diseases that I would not otherwise see. And this, thankfully, will help prepare me for the future as I look to doing full-time medical work overseas. In addition, I was able to bring my wife with me, who had never been to Africa before, so for her to be able to see what it's like, and she's gung-ho about it now as well. You know, we have this healthcare crisis in America, and we order all these tests that a lot of times aren't necessary and our patients don't want. And so it kind of reconfirmed for me that I need to listen to my patient, and maybe ordering the next newfangled test is not the best thing for them. I would encourage anyone to at least have that experience for various different reasons. One, the need is huge. I cannot stress enough how much help they need. And secondly, there's great reward, personally, as well as being able to help people out and having reward in their lives. And third, it's a great challenge. You really get to be stretched personally, professionally. And so I would recommend this for anyone, you know. And I'm really pleased, and it's actually one of the reasons I chose to be trained here at Mayo, was the Mayo International Health Program helped defray some of the cost to go. And quite frankly, with a young small family, there would be no way that I could have afforded that had it not been for the Mayo International Health Program. It's a great way for people to at least get another experience or go for their very first time and be able to serve the underserved in a real meaningful way.